Another one of our top stories today, the massive spike in COVID cases in North Carolina. As of today, more than 4,500 new people testing positive for the virus, and that is the highest count for the day that we've seen since mid-February. Over the last 2 weeks, more than 9.5% of COVID tests have come back positive, and today, more than 1,700 North Carolinians are in the hospital battling serious cases of COVID. Those hospitals are filling, and WCNC Charlotte's Ashley Daly is joining us live from Atrium Health's Carolina Medical Center to talk just about that. So Ashley, an ER doc told you today the beds there are full.
Yeah, Vanessa, not only did he say that the beds here are full, but he said the number of people coming into the ER positive with COVID has increased dramatically since June. And so doctors here are asking anyone not suffering from a true emergency seek out an urgent care instead. With COVID cases again on the rise, ER docs asking people to avoid the ER unless it's a true emergency.
The emergency departments across the state and across the country are very, very busy. Hospitals are full,
including those right here in Charlotte, according to Dr. David Callaway, Chief of Operational and Disaster Medicine at Atrium Health, Carolina's Medical Center. He says an increase in COVID cases partly to blame for pushing the ER over capacity, saying cases have increased sixfold over the last 2 months.
In May and June, the COVID rates largely dropped off, people coming to the emergency department. And then in July, we've seen a dramatic case. There's not a shift that goes by where I'm not seeing and admitting, 3, 4, 5 patients with COVID who are pretty sick.
And many of them, he says, are children too young to receive the vaccine. He says masks the one way to help keep young kids healthy.
As a father of a 6 and 8-year-old who are enrolled in public school in Mecklenburg County, and then obviously as an ER doctor who works in our pediatric emergency department, I can tell you a couple things. One is that kids in school should be wearing masks, period.
Again, doctors say because of the increase in COVID cases and patients headed here to the ER, they are asking anyone not suffering a true emergency to maybe see your primary care or an urgent care instead. And how do you know what's a true emergency? Well, Dr. Callaway said today if you have trouble breathing or chest pain, that might be an emergency. He said otherwise, if you're unsure, Atrium also has virtual appointments as well, which can offer you some guidance. Reporting live, Ashley Daly, WCNC Charlotte.
Ashley, thank you. And that advice includes COVID testing. Novant Health reminding people that you should not go to the ER just to get a COVID test. They say this has been happening a lot lately. You can find COVID testing at primary care and pediatric clinics, urgent care clinics, and most pharmacies.